Thank you, Derek. See how easy it is to register? And he did it live in front of everybody. We encourage you to register your workplace today before you leave. We have laptops available following the presentation for registration if you'd like to do it. You don't have to do it in front of everybody. You can do it privately. If you have your smartphones turned on, you might want to tweet out, tweet number 2, that's on the back page of the agenda. And Dr. Watson Creed is a native of PEI and graduated from Dalhousie Medical School in 1999. In 2005, she became the Medical Officer of Health for the Capital District Health Authority. Although she has a full-time job outside of home, she now considers her real full-time job to be a mother of 2 small children aged 8 and 6. Yes, that would be. And they keep her very entertained, amused, exhausted most of the time. Dr. Watson Creed and her family reside in Dartmouth. Please help me welcome Dr. Watson Creed.
Okay, thank you for that welcome, and good afternoon, everybody, and good afternoon to you, Mayor Savage, in particular. I always love following the mayor at an event like this because he actually speaks about health issues better than I do, so I think that's amazing. So thank you for that. This is going to make this very easy. We'll be out of here in no time. And it feels like I'm kind of walking into a room of old friends, which is just funny. I'm having a little bit of a romper room moment. I see Jerry and Kim, I see Gabby, and I see Karen, so it's kind of nice. It also makes my job today a little bit harder because I get the impression that I'm quite clearly speaking to a room of the converted. And this actually breaks one of my cardinal rules of public speaking. Okay, I don't really have cardinal rules about anything. But when it comes to public speaking, I try not to teach people things that they already know. That's going to be really difficult in this room. So again, this is going to be very brief, which is nice. So thanks everybody for the invitation to be here. Thank you to Stepping Up and Smart Trip and Clean Nova Scotia. I bring greetings on behalf of Chris Power, who's the CEO of Capital Health, and Chris wants me to convey Capital Health's willingness to take up the challenge this year. So McGinnis Cooper, it's on. So we will see what happens as we participate in this year's event. It is one that aligns with our own goals as an organization of reducing our environmental footprint and contributing to the health and well-being of our employees, our citizens, and our community. So thank you for that. So commuting, whether it's by active transportation or by mass transit, of course, has many benefits. The use of anything other than single occupancy vehicles improves health by improving air quality, as we've heard, not through reductions necessarily in speed, but through improved traffic flow and fuel consumption efficiency. And I just want to show you this one thing. I don't know if folks have seen this type of slide before. This is a graph of air quality emissions according to vehicle speed in a pedestrian-friendly neighborhood. And what you see is that the air quality emissions at low speeds are actually quite high. That's basically idling, right? So it's not necessarily low speed that we need. It's efficient movement of cars in areas where there are other users of the roads and walkways that we need to see. And so this is something that can be achieved by well-designed active transportation and, of course, mass transportation. The health interest, of course, in air quality is that when you improve air quality, reduce emissions, you reduce the triggers for a number of health conditions like asthma and certain cardiac diseases. So air quality matters, reduction of emissions matters, mass transportation matters to us for that reason, active transportation matters for that reason. But of course, you already knew that, right? Further improvements in commuting by active modes in particular, of course, improve physical activity rates. And our involvement in those modes that keep us together in community with one another, of course, improve our connections to one another, what we call social cohesion. And that in turn improves our mental health and our community's mental health as well, reducing crime and our perception of community safety. But again, you already knew that. There are economic benefits that we've heard about to physical activity, so for the individual and for the community as well. So what we're not spending on expensive upkeep of roads because we're not using them as much goes into other sectors that desperately need that. As well as the individual benefits that we've talked about in terms of your savings on fuel and on parking and on parking tickets, which is my biggest expense usually. And all of those things associated with single user occupancy of a car. So again, there are all kinds of benefits to commuting. But these improvements have to be designed carefully. And so here you have an example of a really well-designed traffic calming measure, a little tiny traffic island, with a bike lane that's able to go around the island instead of what's on the bottom right corner, which is a bicycle would actually have to go basically around the island close to cars in order to get by. So when we're thinking about improving the situation for, in particular, active transportation, we have to keep in mind that we have to build these improvements quite well. They have to be quite thoughtful. It's not just about slower speeds. It's about where the traffic goes, where the people go, where the bicycles go, where the other users of the road are. And sometimes we forget that there are other users of the road that need to be important in our planning strategies. What this means is that how we build our environments matters to health. And again, I'm guessing you already knew that. So up to 10% of what we build in our communities, 10% of our health is impacted by what we build in our communities. So the very way we structure our roads, the very way we structure our sidewalks, our play spaces outside, all of these things contribute to health. And so this diagram is used quite a bit in the health and planning literature, just to point out that you've got this nested impact between how we plan our environments and the policy sort of environment that supports that, and then the outcomes from that at the individual level, and then ultimately leading to population health outcomes that we all want to see, healthier communities, as Mayor Savage talked about. So how we build our environments matters. So this is all stuff that the people in this room know. So here is what I'm actually here to ask you about. I just have one simple question. Why? Why are we not commuting as much as we think we should be? So this I borrowed from HRM Planning. Thank you, Maria Jacobs, for the last minute save on that. Just this morning, and I had seen this slide before and it interests me. So this is the breakdown of modes of transportation in the city of Halifax as of 2006. The 2011 data, I think, is coming later on this year. So this is from Canadian Census data. And so here you can see that about 10% of us are using public transit, about 11% of us are using active transportation modes. And what the regional plan would like to see, what the city planners would like to see, is us double that active transportation number in particular by 2026. That is quite a long way from where we are now. Why? Any guesses? I'm just curious. Yep.
I'm actually scared of the bike.
Ah.
Really certain areas all bike.
Perceptions of safety. Yeah, yeah. What else? Yeah.
Jobs are being exported to business parks that are less accessible by foot than by bicycle.
Right. So it's not efficient to go by active means of transportation. Yeah. Yeah. What else?
Sprawl.
Sprawl. And what about sprawl in particular?
People are living further and further away from where they're
Right.
and all that.
Right, yeah, so accessibility again. So the literature actually points out several ways in which we can think about what impacts the determinants of people using active transportation, and I would say mass transportation as well. So they talk about many of the things that you've already spoken of. So now I can't read my own list from here. What does it say on the top? Safety, safety, so we heard that, right? So if folks don't perceive that it's safe to be outdoors, walking or cycling or skating to their destination, they won't. That can be for a variety of reasons. It can be because the infrastructure doesn't feel safe. It can be for violence reasons. It can be all kinds of reasons. The same is true on our mass transit. If you don't feel safe on the bus, you may not want to take it. So I was having this conversation with some colleagues this morning, and I had been thinking about, in mass transportation, these same principles apply. And a colleague looked at me and said, yeah, if I don't feel safe on the bus, I'm probably not going to take it. So these are improvements that we have to design just as carefully as we design the improvements to our roadways and our sidewalks. What's second on the list? Aesthetics. So does it feel nice to be there? Is it somewhere that inspires you to be there, that you want to go to? So some of our active transportation trails, I think, have really done, the improvements there have really done a lot of great work in the city of Halifax. around creating inviting outdoor spaces, inviting outdoor networks for us to engage with. I'm not entirely sure that all of our buses are aesthetically that engaging, but it's a curious experiment to me. I'd be interested to know, what would a really aesthetically exciting bus interior look like? I have no idea, but it's something for us to think about. What's third on the list?
Efficiency of mass and active transit routes.
Efficiency. So, and we hear this a lot, right, is that if you can't get there quickly, there's no point. I do this myself. I have 2 small children. And so I use all kinds of reasons to not use public transportation as an example. Oh, it's too far. I'll never get there. I have 5 meetings back to back. There's no way that I can go between them all by using the bus or by walking, that type of thing. So efficiency matters. What else? What's noise? So this comes out quite strongly in the literature. That folks will, if they perceive that a particular active transportation route is noisy because it's next to a highway, for example, they may not use that route as much as a quieter route, right? And again, I think the same can be said for buses. So that somebody was telling me a story just this weekend about trains that have quiet cars in the US. So this is a no-talking car. If you are an introvert and you just want to stay in your introverted space and be quiet with your book, you can go into the no-talking car. Now, some people, extroverted people, I'm guessing, are quite offended by the idea of the quiet car. What do you need a quiet car? But noise matters in terms of how we enjoy our spaces, and we don't all perceive them the same way, right? So we don't all enjoy them the same way. So these are some of the things we have to think about in terms of encouraging people to use active transportation, to use mass transportation, as we try, you know, sort of to move our modes of transportation away from single occupancy vehicles. So all this points to what we call in the health promotion literature, what we sort of name as, we have to make the healthier choices the easy choices. And these are the reasons that people will choose something over another, right? So as you're going about your challenge in June, I want you to think about where the choice is easy and where are they not so easy. And I would encourage you to give that feedback to HRM on the Commuter Challenge website. I think we need to hear that. So I sit on the Regional Plan Advisory Committee, Community Design Advisory Committee, and these are some of the issues that we're looking at as the Regional Plan is open right now for review. The Active Transportation Plan for the City of Halifax is open for review, as Mayor Savage had indicated. And I think the Transit Plan is coming up this year. So these are all opportunities for citizens to get engaged and to talk about the issues that prevent these from being the easy choices now, but that we can change for the future. And I think there's a real willingness, certainly, to do that. And from the health sector, I would say we would support that absolutely, because it makes a lot of good sense. That's all I have to say. I'm hoping it made sense and that we're not too far over time. Okay. Enjoy the launch of the Commute today. Enjoy of the challenge today. Enjoy the challenge in June. McGuinness Cooper will see it with the cup. And that's it. Thanks, everybody.
Thank you so much, Dr. Watson-Creed. You certainly have given us lots to think about and to take action upon. And we appreciate your involvement in the kickoff to the Commuter Challenge. And please accept our token of our appreciation, one of our lavender plants. And I'll get you also to make a draw. Our next prize is a free bike tune-up from the Bike Peddler on Portland Street. And while we're making the draw, I just wanted to make sure, or to mention, that you take in some of, as Gabrielle had mentioned, of the many Bike Week activities throughout HRM. David McIsaac and Gabrielle are here from the Bike Week Committee if you want to get involved, and the event soon will be listed on the website halifax.ca/bikeweek.
Okay, draw time. Linda Young.
Oh, what?
Yeah, yeah, yeah.
Thank you for that.